You made it through the full information-heavy lecture. This is not that. Think of this as the reset. When we went through everything synchronously, you were tracking mechanisms, guidelines, dosing, side effects. Your brain was working hard. That's necessary. But retention doesn't happen in overload mode. This session is about locking in what actually matters. Here's your first anchor. 5 half-lives equal clinically gone. That's it. If a drug has an 8-hour half-life, multiply by 5, about 40 hours before it's essentially cleared. Why does that matter? Switching medications, toxicities, drug interactions. Pharmacokinetics sounds big, but it's simple. What the body does to the drug. Let's keep receptor pharmacology simple. Agonists turn the receptor on. Antagonists block it. If two drugs compete, the one with higher affinity wins. Now here's where it gets interesting. Patients aren't identical. Genetic variations, single nucleotide polymorphisms, can change how enzymes function. This one shows up constantly in clinic. Afrin works beautifully for 3 days. After that, it starts making things worse. Rebound congestion. So if someone says, I've been using it for weeks and I can't breathe in, this is likely why. Allergic rhinitis first-line therapy is intranasal steroids. Cromolyn, preventative. This is a big one. If someone is using albuterol every day, their asthma is not controlled. Full stop. That's your signal to step up therapy. Mild persistent asthma needs an inhaled corticosteroid. Teach them to rinse. Thrush is common and preventable. Increased rescue equals reassess. Now, COPD. If you're thinking maintenance therapy, think LAMA first. Long-acting muscarinic antagonists reduce exacerbations. If short-acting inhalers aren't enough, you escalate. But remember the anticholinergic effects, glaucoma, and urinary retention. Guidelines aren't there to overwhelm you. They're there. This one is about discipline. 3 days of clear drainage, viral, supportive care. 10 days with fever and facial pain, now we're thinking bacterial. Infiltrate on chest x-ray, pneumonia. Diagnose first, prescription second. Not every cough deserves antibiotics. This last anchor is about mindset. Schedule 3 drugs have moderate abuse potential. They can cause physical and psychological dependence. Children are not small adults. Older adults don't clear drugs as efficiently as younger adults. Always ask about over-the-counter medications. Patients forget. Interactions don't. Step back for a second. None of this was complicated. That was intentional. Clinical care can feel overwhelming, but your thinking doesn't have to be. If these anchors are solid, the details organize themselves. You don't need to memorize everything. You need to recognize patterns. Clear thinking protects patients. That's the goal.